Wheezing in children is quite common, more so in children below the age of 5 years. Almost every child goes through an episode or more of wheezing, especially when they are having an attack of respiratory infection. Viral infections do produce wheezing in young children because their areas are narrow. Even with mild edema, swelling and sputum, the airways gets narrowed and whistling sounds will be there. That is manifested as wheezing. No doubt allergies have increased all over the world, especially more so in the advanced countries. Developing countries like us also are having increased incidence of allergy and bronchitis, and asthma, childhood asthma is increasing day by day. Bronchiolitis is one of the commonest lower respiratory viral infection, usually in the winter, caused by respiratory syncytial virus infection. It is a self-limiting disease, comes with cold, mild fever and wheezing and breathlessness. It hardly lasts for 4 to 7 days and then subsides on its own. And this should not be confused with asthma of the childhood because they are isolated episodes. Other respiratory infections also, viral respiratory infections also can produce a wheezing. It is called as wheeze-associated respiratory illness. These are common in young children below the age of 5 years. It is associated with fever, cold, cough, wheezing, breathlessness. And in between the episode, the children are normal. Whereas childhood asthma is not uncommon below the age of 5 years. Whenever there is a family history of allergy or asthma, allergic rhinitis, allergic conjunctivitis, allergic sinusitis and asthma, there is every possibility of the children having the similar problem when they are below the age of 5 years. A history of atopic dermatitis when they are young, below the age of 1 year, is also one of the markers for childhood asthma. When the episodes are more than 3, occurring frequently, and in between the episodes also the child is having a problem, more in the winter and rainy seasons, more in the nights, more associated with activity like running, jumping, laughing, crying, and whenever they get relief with a beta agonist medication like salbutamol, then there is every possibility that this child may be suffering from childhood asthma. So if the markers are there, if recurrent attacks are there, in between the attacks also the child is not well, then these children can be labeled as childhood asthma. If you have any doubt, you can give a medication trial of inhaled corticosteroids for 12 weeks to see the response, and after that stop it. If there is any recurrence again, you can restart it as a childhood asthma. So it is a therapeutic trial, therapeutic diagnosis. And above the age of 5 years, asthma is not uncommon in children. It is growing every year in prevalence, mostly because of increased incidence of pollution, vehicularization, industrialization, and the type of lifestyle and the type of nutrition the young children are getting, additives coloring agent, flavoring agents, sweetening agents, over the counter foods, mostly smoking, indoor pollution, chemical pollution. Whenever above the age of 5 years, the children have a recurrent episodes of cough and wheezing, nocturnal, seasonal, with a trigger associated, exercise-induced activity, family history, history of allergy, and these children are treated as childhood asthma. There is no need for any particular investigation. All the investigations are to rule out other conditions. And treatment of this wheezing in childhood is on the protocol based. Whenever a child gets a wheezing due to asthma, we have an opportunity for relieving with a reliever, and we can control the disease with controllers. The best gold standard controller is the inhaled corticosteroid. Budesonide is commonly used, fluticasone is also used. The other alternative or add-on is leukotriene antagonist like montelukast. This is specifically useful in exercise-induced attacks when associated with allergic rhinitis, asthma with allergic rhinitis, and in young children. This may be useful along with the inhaled corticosteroids. So, objective of management is to avoid triggers and at the same time relieve the attack and control the disease, so that child should sleep like any other child, play like any other child, go to school like any other child, live like any other child, and grow like any other child. And they can become champions with good usage of controllers in any field. So they are like normal children. So one need not worry about asthma and wheezing in children. They are manageable, they can be controlled, they can be treated well, and we can give a very good prognosis for all these children.